Hi, my name is Dr. Emma. I'm a dermatology doctor working in London, and I'm also the co-founder of the House of Medics. So I'm going to be doing a series of videos to teach you how to suture. This is by popular demand. So in this video, I'm going to talk you through this kit that the House of Medics has put together, and it's got all the different instruments in it that you need to be able to learn how to suture. And then in the next few videos, I'm going to show you how to do a few different types of sutures. And in future, stay tuned because we'll have some special guests who can talk us through a few different types of sutures as well, because there are actually loads. So I'm going to get right into it. I'm going to open the kit and show you all the different instruments. Okay, so in the kit, you've got your sutures here, but I'll talk a bit more about those later. And then this is the skin pad. So this is obviously what we're going to use to practice the sutures. The good thing about this skin pad is it's just like the skin in that the pink bit that you can see on top represents the epidermis. So that's the top outer layer of the skin. And then just inside that, there's a sort of translucent-y type of area. That's the dermis, which is the deeper level of the skin. So the skin, you have the epidermis at the top and the dermis at the bottom. And that becomes important when you're doing your different types of sutures. And then the bit in the middle, that sort of represents fat. So of course, if this was a real wound, when you cut into it, you cut through the epidermis, then the dermis, and underneath you see what we call the subcutaneous fat. So this is my skin pad. This is what we're going to use to practice the sutures. Now let's talk about the instruments. So inside this pack, I'll just start from left to right and I'll talk you through what we've got. These are your forceps. So these are non-toothed forceps. There are other types of forceps that have bits sticking out towards the middle called toothed forceps, but these are your non-toothed ones. And usually you use these pretty much in your left hand, and they help you manipulate the skin in the area that you want to put the skin in, and you can also use this to help you control your needle when you're doing the suturing. Next up, you've got your needle holders. So these are probably the most key instrument when you're doing the suturing, because not only do you need them to hold the needle, you also need them to do your instrument ties, which I'm going to be showing you. One of the most important things about the needle holders is the way that they open and close. So the needle holders have this locking mechanism, so that once you put the needle in, you lock it together and it stays, in place. So often when people first start using them, they find it really difficult to lock and unlock. But you just need to practice, because once you've got it, you've really got it, and it's just super easy. So you put it together to lock, and then to open it, you push it together before you open. If you try to just open it while it's locked, it will never open. So you push together and then you open. And I would say that if you get one of these kits, just walk around practicing opening and closing the needle holders, because it's super key when you're actually doing the suturing movements, which you will see. All right, up next we have the curved needle holders. So you don't actually need these too much just for practicing sutures, but we do use these in real life, in practice, usually to hold things in place, or sometimes if you've got a bleeding vessel, you can clip it closed with the curved sutures, so the curved needle holder, sorry. So I'm going to put this to one side for now. Next, this is the scalpel holder, and also in the pack you've got your blades. So of course you want to be super careful with this. These are real blades, they're really sharp, but I'll show you how to open up the blade and how to attach it to the scalpel holder to actually make the scalpel. So it just opens. Of course in real life your hands would be sterile, you'd be wearing sterile gloves, and all of this field would be sterile. So usually we open things like this and drop them onto the sterile field. Now, some people put the blade on the scalpel holder with their hands. That's absolutely fine, but of course it is a sharp blade, so I usually use the needle holders actually. What you'll see with the scalpel holder is it has this diagonal line going across, and that perfectly matches up with the diagonal line here at the bottom of the blade. Now, making sure you've aligned it correctly, what I then do is hold the edge of the blade with the needle holder and then slide it on. And then it just locks together like that. So that's what I do at the beginning of all my surgeries. And then my scalpel ready. And the last thing, you've got a pair of surgical scissors. Of course, you need this to cut the sutures. Sometimes when I'm doing biopsies as well, I actually use this to cut the biopsy from the skin so that it can go in the pot. So your scissors are obviously super important. The way in which we hold scissors in surgery, I usually put my thumb and my ring finger in the holes, and then I have my index finger on top to stabilize the scissors. So obviously you're working with human tissue, everything has to be very precise. So what you want to do is make sure that you stabilize your instruments as much as possible. And having this index finger here just really helps to keep things stable and secure. Another thing is when we're using scissors in surgery, we always use them at a flat plane like this. You never want to go into tissue cutting like this because you can't see what this bottom portion of the scissors is doing. So we always use the scissors flat like this against the skin so that I know exactly what I'm cutting. And then like I said, this is my skin pad. I'm going to put the case to one side and talk about the sutures. So of course you can't suture without the suture. So I'll open this up and show you what's in there. Again, this would all be sterile. So usually we open up things like this and let it drop onto the sterile field. And then there's a second pack here basically. So you tear this open. And inside you will find your suture. Now sutures come in all different shapes and sizes. This is a 3/0, so it's a reasonably large needle, but it comes like this. And what you would do is pick up your needle holder, grab the needle, and then just pull it out. This suture is super long. In real life, they're not usually this long, but it's long in the practice kit so that you can actually get a lot of practice in. Obviously, if we gave you short sutures, you wouldn't be able to practice as much. So it is significantly longer than it is in real life, but otherwise, it's exactly the same in that you have your needle, which is curved, and then that goes straight into the suture. Okay, so these are all the instruments that you get in the House of Medic suture kit. It's got everything you need to actually practice how to suture, and that's what I'm going to show you in the next video. We've got 10 different sutures in here, so more than enough to get lots of practice in. If you're interested in getting one, the link is in the description down below, so grab one and follow me to the next video where I'm going to teach you how to tie a simple interrupted suture.